All right. Good evening, everyone. And welcome to this week's edition of Sisters of Legacy. We are going to run our intro and we will be right back.
Welcome to the Sisters of Legacy. They are building a community through great conversation. They are speaking truth. They are speaking life. It's time to do more. Join us each week. Welcome to the Sisters of Legacy.
All right, ladies, we are back. So, again, welcome to tonight's edition. We are going to be talking about, can you see it on the bottom? The complexities of womanhood. Aging gracefully or grumpily. So I'm just going to say that I am not aging gracefully. So you can go ahead and just check off that other option. So we do have a professional here to help us out, maybe help us untangle some of this very complex web that we have. What is it? Woven. We do have an expert coming, so I am just gonna bring her in, um, and she is going to help us out. So we have Dr. Tiara, and she has Aldridge, but we're gonna say Aldridge slash Brown.
Sure. I'm still Aldrich at work.
Okay,
Brown at work.
okay, I got you. Okay, so we just gonna call her Dr. Tiara.
That's
Either way,
fine.
she's a doctor, and that's the important part.
Right.
Okay, so Tiara, first, welcome
Thanks.
again.
Thanks for having me again.
Listen, I need help. I'm just gonna say I probably am the one struggling the most. So tell us, let's slow down for our, speed the train ahead. Tell us what kind of doctor you are.
So I am your woman doctor. I'm your OBGYN. So the one who you can come and talk to these things about.
Okay, that sounds like a good plan. We definitely gonna be focusing more on the GYN part because that OB is over.
We're past that.
Not
Yes,
everybody here. Exactly.
that
So,
part is long over for everybody on this panel. So
Understand.
mhm.
we gonna slide right into the GYN part.
Sounds
Um,
good.
so I am first. I'm gonna say it's going. I apologize because I am sick.
Oh no.
I had a little bit of something, and so it that's not helping with all the other craziness I got going on. So I'm gonna try really hard to not be doing all the sick things tonight. So I'm just gonna say I'm 47 and I've had kids, done all that great stuff. Um, I'm sure I'm probably about to overshare, but hey, let's go for it. I've had a partial hysterectomy some
Okay.
years ago though. Like because my daughter's 14, so I had it after her. So it's been 14 years. And they were like, "Oh, well, it might send you, down the menopause lane and whatever." And I was like, "Oh, I don't care, just take it out. Let's get rid of it." I mean, cuz I was having a lot of issues. So I was like, "Well, we'll deal with it." So basically for about 13 years I was good. I'm going to say 13 and 3/4. I was doing good. I didn't feel, like I had a little hot flashing, here and there.
Yeah.
I was okay. But these last couple of months is
Mm.
like somebody flipped the switch straight to crazy. Like I have, I have taken a turn down the road of no return.
Mm.
I don't even know. And so I was telling the girls, the ladies, I'm sorry, that I'm not even sure if this is attached to menopause. I'm thinking I'm hoping that there's a reason for the extra crazy going on in my life. But
Okay.
like I don't really know. Like I'm so emotional. Like
Mm,
I'm not typically an emotional person. Like literally, I can't tell you outside of church the last time I've cried for anything.
mm,
Like I'm not a crier. Never have been. Maybe my mother might say different, but like not since a teenager I haven't been a crier.
yeah.
All of a sudden, these last few months, I could just be sitting and my eyes start welling up and
Just out of nowhere.
yeah, nowhere. It don't be nothing happening. And then I'm upset because I don't cry and I don't want to cry.
Not a crier.
No.
Okay. So I will give you some reassurance that mood changes are a pretty common occurrence in
Mm.
menopause. It may have something to do just with the fact that your hormone levels are starting to kind of decrease, because I'm guessing they left your ovaries since you had a partial.
I got one.
Okay. So with that, even though you weren't having bleeding or cycles, your hormone levels were still kind of cycling regularly to let you be able to transition still
Mhm.
kind of normally into menopause. And so that's probably why you're starting to experience those symptoms now. Because you can even start to experience some of those symptoms, what we call perimenopause. So those years kind of leading up to menopause, when your hormone levels are starting to kind of change, your ovaries are starting to work less regularly. Um, and so, from my experience, mood changes would fall into one of the most common things we see as those changes start to occur, along with like hot flashes, night sweats. I would say mood changes, weight gain, and dryness are probably the top five things that
Wait
I
a
see.
minute. Hold on. I'm sure I'm probably going to regret asking this.
Don't do it.
Dryness where?
Never
That
mind.
dryness.
That's
Yeah.
exactly what she meant. Let's keep going.
Yeah.
That's
All
what
these
she
is
meant.
the result of your body starting to change. So
Is
um
it starting to dry up? What is going on? Wait a
it's
minute.
your lubrication comes from is related to your like estrogen levels. And so when you're not making estrogen, one of those hormones from your ovaries, as they're starting to kind of slow down, things start to get a little, they can get dry.
Okay,
Now,
wait a minute. Okay, so two things. One, I'm not sure I'm adult enough to have this conversation. And then two, I didn't sign up for all of that.
I know, right? But you
I
know what?
did.
Who
The,
did?
everyone's journey through this process is different. So not everyone gets any or all of those. I've had some women who've had no symptoms at all. They just kind of stop. Their cycle stop and that's it. They don't have any hot flashes, no issues. While I have some women, even in their again perimenopausal years, again, those are those years that pause, they experience almost all of them. And so everyone's journey is just different. And so we kind of go based off of the individualized patient to make sure we're treating them, because it's not kind of a one size fits all journey.
So, doctor, can you just kind of walk us through the whole, like the how it goes?
The stages,
Perimenopause,
yeah,
perimenopause, and then like
the
just a
after.
general overview so we kind of on the same page.
Yeah, so your reproductive years, that's when you are having normal cycles. Those are the years where you're going to, if you want children, that's when you can have them. Um, and then as you, typically mid to late 40s, but I have seen it sometimes in early 40s, you may start to enter what we call perimenopause. So those are those years where, again, your ovaries are starting to slow down. So you're not ovulating regularly. You may not ovulate some months and other months ovulate. That's when you release the egg from your ovary. Okay. And because of that, because your ovaries aren't working as regularly anymore, you start to experience changes where some women cycles may change. Sometimes they get further apart, sometimes they get closer together. Some women's cycles get heavier, some cycles get lighter, some get longer, some shorter. All of those are a result of your hormone levels not cycling regularly. But with that can come some other side effects. So you may start to experience like hot flashes, night sweats, like I said, dryness, mood changes. So women have issues with like sleep or changes to the hair and skin. And a lot of these are just a result of, again, your hormones not being as robust or regular. And then eventually you'll reach menopause. So menopause, technically, the definition is once you've gone 12 consecutive months with no bleeding at all, no spotting, no brown discharge, nothing at all for 12 consecutive months off of birth control. So we know birth control can sometimes stop your cycles. So it's when you're not on anything and you're not having cycles for 12 consecutive months. So that is menopause. A lot of people will ask to have their hormone levels checked and things like that, but it's really we're going based off of what your bleeding pattern is doing. So that is officially menopause. Average age of that is probably about 51 to 52. But some women a little bit before that, some women a little bit after that.
So is that I heard you say when you're not on any type of like medication or anything that like creates that situation.
Right, exactly.
That even would you consider it menopause even if there was a medical procedure that, or is it not considered menopause? Like how do you differentiate between
right
that side of it if there was like a medical procedure that prevented those things from occurring?
So in that situation, like that would be like a hysterectomy or even like an ablation. Like if you had the ablation where they burn the lining of your uterus down, if that ablation stopped your bleeding altogether, I would say those are the situations where checking your hormone levels are actually going to be helpful because we can't go based off of what your bleeding is doing. And so in those situations, we would check your hormone levels to see if they are consistently low. And in that situation, we would go based off of that, I would say. And those two, in that situation where you're surgically, unless at the time of your hysterectomy, if you had a hysterectomy, if they removed both ovaries, then that's officially menopause as well. So menopause is basically when you are devoid of hormones, whether that's surgically or kind of naturally.
Okay, so let me ask you this. So you get your 12 months, you reach that finish line. I made it to menopause. Here we are. But what? So then, if you're supposed to be devoid of these hormones, why do you still have all these things happening once after you cross the finish line? Like you can still have hot flashes, still have like for me, I still on a monthly basis get a headache, like right on time. So I'm like, well, wait, I thought I was done with like cycle stuff, but I still get a headache, like clockwork.
Yes.
So, like, what's happening with that? Since my hormones are supposed to be
done, it's a withdrawal effect from your hormone. So, yeah. So, even when you think of like your PMS symptoms, those things happen right before you start bleeding, and that's when your hormone levels dive down. That's when you get a drop in your hormone levels, and so it's similar kind of thinking. So you're not making hormones anymore, so you still can have those kind of withdrawal side effects, even though they're not coming and going. You can still get those side effects until your body has completely adjusted to being without them.
Gotcha.
Okay, I got a question.
Yeah.
First, I just want to say I thought you were going to make me feel better about some of this. I just start there. Second, I want to say I'm not sitting by you in church anymore. I'm gonna sit on the other side of the room.
You can know we can still come
And then okay, so it's been 14 years for me. Like I am not, none of that stuff. If I see anything red now, I'm going to the hospital because there was
Yes, you
something so
should.
clearly wrong. Like,
Exactly.
but
Yes.
like
For
I,
you, it's
I don't
because you still had an ovary, though. So your ovary, even though you only had one, was still working for all of these years.
I think it's just in there flopping around. I don't I am convinced it's not doing anything useful.
Now,
Like,
now you're start. Now it is probably starting to slow down because now you're at the age where we expect that to start happening. But those 13 or 14 years leading up to this time, it was still fine. But now it's starting to not function
okay,
as
so I'm are we saying hypothetically that this is gonna possibly affect my nighttime life?
there's
Sorry.
always that potential, but again, it doesn't happen for everyone. So the the part that I thought was going to be encouraging to you is that this is very common for most women.
No,
You're not in
listen,
this alone. You are not alone in
I
your,
don't care.
but
Listen,
everyone's journey is different. So you may not experience that. I have some women who don't have any issues in that regard. So we just kind of
I'm
have to take it as it comes.
I'm gonna have to put your number on speed dial because
Here for it.
if stuff start going wrong, we gonna have some real issues.
I'm here for it.
Oh my goodness, this is a lot. I don't, they say, the more learning is fundamental. I didn't want to know this much. I rather would have just been surprised. Like,
Right?
oh, where's that coming from? Like this is a lot to process.
But also, you know that it's not something that is out of the norm. Like this is the things that you're experiencing now, can be a part of that journey. And so you're not going crazy. This is something that can just happen.
I think I'd rather just be cracking up, just like listen, I work with a host of men. I'm literally the only female in the building.
Mm-hmm.
Today I was sitting at my desk. Okay, I'm already almost sick. I'm sick. Got something happening. But then I was like, my eyes was watering and stuff. And I'm like in there trying to put my hood on, like so that I don't look like a totally crazy person.
I
Is,
got you.
is there a pill? Is there a prescription? Is it something that could dry up the tears, the crying?
And so that kind of brings me to my next point. The good thing is that most of the symptoms can be managed or treated. And so the one thing is that there's not one pill that's going to fix every symptom of menopause, unfortunately.
We
Uh,
go up, we go down. What's happening? I don't understand.
but there are ways to manage the individual symptoms. So for mood changes in particular, I know no one likes to hear this term, this word, but antidepressants are kind of the first go-to for,
Oh
even though
no.
antidepressants, we use them as kind of just something to kind of stabilize your mood or kind of mellow you out where you're not having those ups and downs, those
Happy
peaks.
pills.
Happy pills.
Happy pills.
Okay, we got a question. We're not gonna talk about your happy pills. So Sonia said, do you have any suggestions on how to deal with hot flashes?
Yeah, so another one of those things that, again, the good thing is that there are lots of ways to manage that. So whether it's non-hormonal, something that doesn't have any hormones in it, or of course there's always hormone replacement, but that has risk to it. So the hormone replacement, that's going to be like your classic estrogen, progesterone, if you still have a uterus. If you don't have a uterus, like you, Sam, then you don't
Thanks.
need the progesterone. You just
Thanks
need the
for that. I like how you say it. Right on.
So,
I think
um,
I think between us we have kind of like a range of kind of like some of the things that you discussed, from
okay,
the hysterectomy to the ablation, which would be me,
gotcha.
to the naturally progressing to the menopausal stage
Gotcha.
between us. So like, yeah, we have the whole spectrum sitting right here, right?
Right.
Yeah. So with the hot flashes, of course, hormone replacement is an option, and again, that's classically estrogen and progesterone. Again, progesterone is really just to protect your uterus from developing cancer, because estrogen can do that if you don't have the progesterone. If you don't have a uterus, you don't have to worry about that. You can just do estrogen. But again, those aren't without risk. Okay, so you just have to talk to your care provider about that. But we think about risk in regards to like blood clots and legs or lungs, heart attack, stroke, breast cancer. So that's, again, that's kind of, but you have to talk to your provider to see where you fall on the scale of those risks. Okay, so some people are low risk in that regard, and there are different kind of individual factors that we take into account to see where you fall on that spectrum. And then also with hormone replacement, there are different ways that you can do it, whether it's a pill or a patch, or now they have even like the pellets or the shots. So there are different ways that you can go about doing the hormone. But the good thing is that there are non-hormonal or methods that don't have hormones in it that are lower risk, of course, because you don't have those same risk in regards to like the blood clots or things like that. So that's going to be things like um, some prescription meds like gabapentin, which is a medication typically used for nerve type pain, but it's also been shown to help with hot flashes, night sweats. That word that I say no one likes to hear, antidepressants, actually at low doses have been shown to help with hot flashes, night sweats as well. So sometimes you can kill two birds with one stone with that. Like you can use it to, it'll manage your mood, but it'll also manage your hot flashes. And so
You
that's
mean
sometimes
the gabapentin?
the antidepressant. So
Okay,
the
gotcha.
one classically used, as I would say, is like paroxetine, or you heard it called Paxil, and maybe like Effector. Those are probably the top two. There is one that's specifically targeted just for hot flashes, night sweats, called Brisdale as well. So you have plenty of options in that regard. There is actually a newer medication on the market now called Veoza. Um, that's supposed to kind of work on the portion of the brain that regulates your body temperature. And so that is newer, but it sounds like it has had good results. And again, you don't have the risk of being on hormones with it. There is an herbal supplement that I often use with patients called Relizin, through a site called Bonafide that you can order offline yourself. You don't even need a prescription for that. And so lots of options out there. We just, again, we kind of, with the discussion with the individualized patient, decide which route you're most comfortable with, and risk factor wise, which would be best for you.
So
And,
the natural one that you talked about, the Relizin, is what you
mm-hmm,
call it. So
yeah,
that can help. So it's like, is it a supplement that you just take daily
yeah,
that and it's
uh-huh,
an all natural product?
yeah, it's a herbal
And that
supplement.
will assist with like the hot flashes and the mood imbalance or emotional state.
So the only one that kind of targets both of those two things specifically are going to be those antidepressants that we talked about. So like the Effexor, the Paxil, the Brisdale. The rest of the ones that I just mentioned are only for hot flashes, night sweats.
So the Relizin will be for hot flashes, night sweats.
That's right.
Okay.
Gabapentin.
So like if I have a hot flash or a night sweat, I can just pop it right then and it's gonna like we gonna
No.
good, or like I have to routinely take it to kind
Have
of
to
control
take.
it.
Yeah, there you
Okay.
go. It's a main type thing.
Like I'm like, it's something I can just pop and like we good to go, and I'm not sitting here doing all the
Right.
okay. I just need to know.
The thing about hot flashes is they aren't dangerous. It's going to be more of a quality of life thing. So it's nothing you have to treat. Some women just kind of grunt and bear it until it's over. But again, we have a lot of options if it is starting to affect your quality of life, and it's to the point where you do want to do something about them.
So typically, once you're in the official menopause, how long is it supposed to last? The hot flashes and stuff. Like once you get there, how long are you going to still have symptoms after you get to the finish
Yeah.
line?
So
No finish line.
Listen, we asking the doctor. You might
she's
have
not gonna
hope for
like
me.
this either. She's not gonna like this answer. So there is no like cutoff.
She told you no finish line.
It varies for everyone. Um,
Oh, what?
I
I
know
was hoping.
some women don't get them at all, and so sometimes I see them end in their early 50s. But I've even had some 60 and 70-year-olds that were like, I still get a hot flash here and there. So it varies. It really does. I will say what one thing that I have seen is when women are on hormone replacement, when they try to come off, they will have withdrawal hot flashes. And again, that's because your body is seeing hormones again. So when you try to start to withdraw, you're going to have those withdrawal hot flashes again. So in that setting, a lot of times I'll encourage women to consider one of the non-hormonal methods as they try to transition off of their hormones. Because there is a time where your risk, again, depending on your age and other factors, where the risk may start to outweigh the benefits of being on it. And you may want to consider switching over to something that's lower risk. But yeah, in regards to time frame of what age you can look forward to for them to be completely gone, there's not one, unfortunately. I know that's not a good answer, but that's the real answer.
See, Sonia, I'm sorry. I'm sorry to have to find out this way like the rest of us, but it's never over. It's never over. I'm so sorry to have to be the one to let you in on that little tidbit.
You
See,
know,
as a woman, we can't catch a break. I don't understand.
Yeah.
When do we need a break?
Our bodies change a lot as we go through the different stages in life. It really does. But and as we address it. So that's what we're here for. Help you through.
Take another pill. Get this pill.
There are lifestyle things you can do as well, though, for like your hot night sweats, have those cooling sheets. They have sheets that are like supposed to be kind of thermal regulatory, where it's like supposed to keep you cool at night. You sleep in light wear, have a fan. Those are kind of things you can do that don't require you to take a pill.
Next to you.
So let me ask a question. In the beginning, when you was already hurting my feelings, you said that it could also affect your hair. Didn't you say something about hair?
Yeah. Some women will say that their hair feels more brittle or starting to thin out. Some of that can be genetic, but sometimes it's not uncommon that I've heard some women that are on their hormones say that they feel like their skin and hair is better. Now, that is not an indication to go on hormone replacement, but it may be one of the side benefits that you get from being.
Uh-oh.
Oh, I was about to say, you can't drop all this information and then just drop out. You can't do that. Uh-oh, we're having some connection issues. So can you hear us? No, because we can't hear you.
She probably has to go out and come back in.
Yeah, let's try going out and coming back, and hopefully that will work. So Sonia, I see. Hopefully you're still sticking in here with us. Yeah, it's not as reassuring as I thought this conversation was gonna be, because I was hoping she was gonna have something very doctorly and hopeful to say that at some point we just get a break, because sometimes as a woman you feel like just always something, right, Tiara?
Can you hear me now?
Yes.
Yeah.
Yeah.
You
Okay.
thought she was gonna come on and say magically it ends at
Right.
56 and a half and like you're
Right.
all done with everything. So like just hang on in there until you
I
get to
know.
Yes, I thought I was gonna count down. Like, all right, just 2 more years.
I
calendar mark.
know. I will say it will come to an end. I just can't tell you when that end will be.
Okay. See, that's encouraging.
When you
Okay.
go on to be with the Lord. It seems like the
Oh,
only way out is going to meet Jesus.
They'll make it better.
So
Come on
I
in,
have
my
a
child.
question. Are there
Your
any
trouble is
like,
over.
are there any like vitamins, like non-heavy type medication, something you could take, simple stuff. Like I take a little vitamin, feel a little better. There's none of that, no vitamins, no extra vitamin C, some D, some E.
you should definitely take your 1 a day women's multivitamin. Okay. The other thing that starts to be affected as we go through the changes are your bones. So I often recommend that you start to take vitamin D,
Wait a minute.
calcium, maybe
Oh,
calcium.
hold on. You said like your bones. So you trying to tell me now I'm gonna be one of them little ladies that start bending over too? I'm already 5 foot nothing. If my bones start compacting,
I
I
know.
would
No,
be the size of a 6-year-old.
it's because estrogen feeds your bone strength, and so when you don't have the estrogen, that you start to become at risk for like the thinning of your bones, so osteopenia or osteoporosis. And so taking your calcium, vitamin D, weight bearing exercise that includes walking, those all of those things are good for your bone strength to maintain your bone density.
So
I
you said
think it makes
vitamin
it even
B,
worse.
vitamin D, and calcium.
Vitamin D, usually like D3, and vitamin and calcium. Just vitamin D and calcium.
Oh, okay.
And then of course taking your multivitamin. She looks so discouraged.
And
Don't look discouraged.
Well, I told you I already wasn't feeling good. Yes. And I was like, I gotta do this show because I need some answers. I need some answers.
I
And
got
I didn't want to cancel. You got a doctor coming on, you gotta show up. But now I think my fever has come back.
Oh no. Oh no.
I have a
my
question.
was over there soaking. I have another question.
Okay, fine.
Yes,
So
ma'am.
let's talk about these vitamins for a second. Do not judge me. I take vitamins, but I take vitamins in the gummy format because
Okay.
I'm 12. Like, I don't care what you say. Like, I take them in the gummy format. Is that okay? Or like, do I really have to go get the hard ones that you have
You
to
need
like
adult vitamins.
No, it's fine to take the gummies. Just make sure you're taking what it says. So a lot of times you have to take 2 gummies, I think, to reach or it usually has the instructions on there of how much you need to take to get the amount. The main thing with the gummies is that it just has a little more sugar in it. So because it's a gummy, but it gets you the vitamin that you're seeking. So that's fine.
Okay.
My next question has more to do with the whole aging as opposed to menopause, although I guess it could be the same too.
Okay.
But I've heard from some older women about use it or lose it when it comes to relations.
Yeah.
So
What?
okay. So what I heard was that there's something called like, and you can correct me if I'm wrong,
Mm-hmm.
something about uterine prolapse,
Okay.
something like that. Like if you are not active
Mm.
in your relations at this point in your life, that it's not like things don't always work.
No more.
I got
You
so
can address that.
yeah. So the use it or lose it, I would say is going to be from our standpoint more so related to the dryness. So the vaginal dryness.
Uh-huh.
So again, with getting older and you're not making hormones as much, not only do things get drier, but the tissue gets thinner and it can constrict, so it doesn't stretch as much. Okay. So if you're not having relations, then that tissue just stays constricted and it can continue to constrict more and more if it's not being stretched on a regular basis, because you don't have that elasticity anymore as you get older. So if you're not using it, it won't close completely up, but it can sometimes get kind of close. But if you are,
if you're not, and like let's say you're not in a relationship where you're using it, and then like you're waiting for that or whatever, is there like you know how when you're having a baby and they teach you to do the Kegels, I think is what they call it. Yep. Could you essentially do that to kind of like keep yourself prepared for later relationship?
Right. That's not going to help the stretch or the lubrication. So usually you have to reprime things, almost, you can think of it. Use things to get your lubrication back, and do things to re-stretch that tissue out, because that can be painful. The prolapse, I would say, is unrelated. Prolapse is usually that's when things start to kind of relax down. Think of it. The walls of your vagina can start to relax down. But those are different risk factors. So we have these strong tissue or ligaments that hold everything up. If those get kind of stretched and torn over time, then things can start to relax down. I would say the number one risk factor for that is having had a vaginal delivery, because as babies come down through the birthing canal, things get kind of stretched and torn. And so
that's like two different things. Okay, I understand what you're saying.
Yeah, so I would say it's not related to being active or not. The prolapse part
is that related to aging at all, though? Like
as you get older, again, things aren't as strong. So we do tend to see prolapse later in life, just because, again, it's kind of a progressive thing that happens over time. So as you get older, if you have those risk factors, sometimes we can start to see things later in life. But I would say anything that causes you to put pressure down there. So some women just having really bad constipation where they have to constantly strain is a risk factor for prolapse. Again, vaginal deliveries. Sometimes
no.
Okay, you're going again. We can't hear you.
So in the meantime, while she's coming back,
did she just say? I saw you do this. I was trying to hold myself.
I had questions.
But when you did this, I almost fell out the chair. Girl, I thought that I was having time right with this information, but clearly this is a lot for you too.
I'm like, wait a minute, because she just threw me in a whole nother classification that I didn't think I was gonna be a part of.
Yeah, so hold on. What are we doing here? Too, because okay, we gotta go back a little bit, and I'm sure probably nobody wants to stop in this section, but this is where we are, so this is where we're gonna stop. So you said something about having to reprime. What is that? What do you mean? Like pour water on it and hope for the best? Like, what are we talking about here?
Yeah, so that's doing things to give back lubrication to your vagina, whether that's using lubricants. If you do use a lubricant, we say use like a water or silicone-based lubricant. But there are other things that you could do, like natural oils, like coconut oil, olive oil. Those can actually be used as lubricants as well. But there are other kind of more maintenance type things that you can do. Like there's the over-the-counter vaginal moisturizer called Replens that you can use, that you would just use vaginally daily. There's a suppository, that same company that does the Relizin for the hot flashes, they do a suppository called Reverie, which is like hyaluronic acid that people use for skin, but it's specifically for the vagina. And it's been studied and shown to be almost just as effective as vaginal estrogen in regards to giving back lubrication. there are a lot of things out there. There's a steroid cream called Intrarosa, which is not a hormone, but its metabolite looks like estrogen. So again, it kind of works similarly to giving back moisture. And then of course you have your vaginal estrogens. So that's like you can use a vaginal estrogen cream or pill that you place vaginally. There's even a ring that you can use called S-string. And the good thing about the vaginal estrogen or the vaginal hormones is that you don't have the same risks as like hormone replacement. So if you remember, I said with hormone replacement, you have the risk of like blood clots, heart attack, stroke, breast cancer. But with the vaginal estrogen, you actually don't have that because it's just acting on the vagina. So you don't get a lot of like absorption into your bloodstream. So it's kind of more of a topical effect. There's even an oral pill if you don't like kind of topical things called Aspina, and it's specifically for kind of dryness and pain with intercourse due to menopause. So there are a lot of things that we can do. So that's one half of the battle in regards to the repriming, giving back lubrication. The other half is stretching that tissue back out, because again, you don't have that elasticity. So kind of getting it to stretch back out. And a lot of times I'll recommend patients considering like the use of vaginal dilators in that regard.
What?
Yeah.
You said use a what?
Vaginal dilators. So they're kind of like little tubes, almost cylinders sometimes, that come in a graduated set from a really small size up to larger sizes. And usually you start with the small size and just insert it until it's not painful anymore. Then you go to the next size up until you get to the size that you desire. To again, doing that plus giving the lubrication back up to par to give your vagina back that stretch to accommodate.
Are there a good number of women that actually need to do these types of, I mean, I guess it has to be in order for there to be like a whole set of things
Right.
are available.
It's actually very common. So
it really is kind of like a use it or lose it type of deal. Like as long as you keep using it, you might be okay. You might need a little help, but you know, you got to keep it going. But if you don't use it, like you're gonna need to work it back out before you use it again. Like you're gonna need to prime it to get it ready. Wow. I'm sorry. The thoughts in my head came rushing out. Okay.
I see.
Oh, sometimes you don't.
I was not aware.
Sometimes you don't need both. Sometimes you just need the lubrication factor. Like sometimes you don't always need the dilators, especially if you've had vaginal deliveries, but definitely if you've never had a vaginal delivery, you haven't been sexually active in a while, and things are constricted, that's where both of those things become kind of beneficial, I would say.
Wow. You know, I was just having emotional bouts. My emotions were just, at an all-time high. You have made me, I'm going to go to bed tonight and have nightmares that I wake up and it ain't going to work no more. I don't.
You said you wrote the complexities of womanhood. It's
complex. It is complex.
The complex side of it. This is definitely.
Oh, husband, you are late to the call. Listen, they said might be some things coming that's not going to be too favorable.
Oh my goodness.
Oh my Jesus.
But again, I'm going to keep reminding you, not everyone is going to experience any or all of these things. You might not have this problem.
Okay, so
you may not have this problem at all. But if you do, we have ways to help you. And so,
okay.
Yeah. I'm on a roll. Here's another one. So
you don't even want to know what you did. Trust me, some of these things you don't need to know. We just gonna go with the fact that I'm overly emotional. We gonna stick right there. Go ahead, Trina.
So the weight loss after menopause, is there anything that you in your profession kind of recommends to kind of combat that, or is there any type of diet that kind of works better for women that are in menopause or perimenopause or whatever?
Now, are you
Wait, you lose
saying that,
weight after menopause?
right? Are you saying you're losing weight or gaining weight?
No, I want to lose weight, but it seems like it's harder now
Okay.
Okay.
at
I,
this point.
I was like, oh yeah, I lose weight afterwards. Okay, let's go.
I was gonna say no. You need to tell me your secret because I'm having issues.
No, it's harder.
No. So yes, it is definitely harder. And that is because as we get older, our metabolism slows down. And so it's more of a metabolism issue. So even women who are eating healthy, they exercise, a lot of times I hear this almost every day. I haven't changed anything in my routine and my weight is going up. And that is because your metabolism is going down. And so a lot of times you have to
So yeah, I'm with you. We are doomed. We're doomed.
oh my goodness, a lot of
This
times
is set up for us to fail. This
you
is
have to do things to make up the difference of what your body used to burn on its own to even maintain your weight. So definitely with trying to lose. So I used to say like exercise becomes even more important the older you get because again your body's not burning it's what it usually burns at baseline. So you have to particularly cardio. You have to increase your cardio the older you get. Um, But some people don't have time, or you have aches and pains and body that prevents you from being as active as you want. And so, what I have seen is that a lot of times, they have a lot of those newer medications out that's supposed to help in regards to like metabolism and appetite suppressants. So I would say the Wegovy or the Ozempic, Monjero, you may have heard of those as some of the more common ones that people are using now. And my postmenopausal patients have done very well using that to just get their weight loss journey started and then diet and exercise to try to maintain that weight loss going forward. But sometimes you just need something to help you get it started. And so those have been pretty successful with helping in that regard. Diet wise, I would say, across the board for women, you just want to watch your carbs just in general. So we kind of carry everything centrally. This is where we gain right here in the midsection. And so carbs are a big one, especially since again, we're not burning our as much as we used to on our own. So carbs like to stick around. So you probably want to stick to kind of a higher protein, lower carb diet just in general. And then again, a big factor is going to be increasing your cardio as much as you can tolerate.
Yeah.
Carbs.
Yeah, pastas, breads. Of course, you got your sweets and your sodas and juices and anything white rice, white potatoes, all of those things.
I like bread and I like potatoes. Like I really like potatoes. I really like potatoes. So I don't know. Like this, yeah, I'm starting to feel a little doomed too at this. Like,
Right.
I absolutely like I literally could eat potatoes every day and
do you like
the happiest person ever.
You like sweet potatoes?
No, I like white potatoes. I like them baked.
No.
I like them sliced and fried. I like them mashed.
She's not gonna eat the sweet potatoes. That's
like
really what she means.
Into little pieces and sauteed or baked or whatever they be doing with them with seasoning on them. I like white potato.
I got you. All forms of
All forms.
White, long as they're white.
So those it sticks to you though. It sticks to you. So
Yeah.
you just have to be mindful. It's not that you can never have these things, but you want to keep them at a
one time a day.
One time a day.
Maybe once a week. It's that
What's a week?
Yeah.
What am I supposed to eat?
I know. I feel you because I love pasta. So I've been having to try to find pasta substitutes, like using like spaghetti squash or zucchini noodles, or they have the protein pasta now, or heart of palm, things like that.
But
So
what do you
I
substitute for a good old baked potato?
uh,
A baked sweet potato? What about that?
that
Here
makes
we
for
are.
one for the week. It just can't be an everyday thing. That's all. So yeah.
Okay, so oh Jesus, I don't even think I want to ask any more questions. Your answers have just traumatized me.
Oh, I'm so sorry.
So basically, the only thing that's gonna get my emotions under check, you saying, is some pills? Like prayer, I can't pray this away.
I was
What is
gonna
it?
say
Jesus for the win, right? Come on,
there
Jesus
are
for the win.
non-medical things, of course. Counseling, therapy sometimes helps. Meditation, if that is a good coping mechanism for you, or prayer.
Hair
Prayer
works.
covers all. So
But that's what I'm saying. Like it's not. There's not anything wrong. Like I
no, that's the
literally,
problem.
right. I literally was sitting at my desk and there was nothing wrong today other than I just didn't feel well. But I was fighting back tears. Like I was just gonna cry because I was sick.
Yep. And that's why those things are still options, but I will say the medication management becomes more utilized because, like you said, a lot of times there's nothing obviously wrong, or it's the slightest thing that can tip you over the edge. And a lot of women are like, it's affecting my marriage, it's affecting my relationship with my kids, like I need to do something just to stabilize things. And that's, if counseling and therapy, you tried it and it's not working, then that's kind of the next step, unfortunately.
Well,
What's
I
the
mean,
name of the all natural stuff on the Bonafide site?
So Relizin was for the hot flashes. Reverie was for the vaginal dryness. They do have one called Serenol, which is for mood changes. So you could consider that. It's a herbal supplement.
okay, wait, spell that one. How you say Saranol?
Serenol is Serenol. And they're all of these are on their website.
I'm gonna look that one up tonight. I mean, I have to say, like my emotions are, like I haven't gotten like out of control with it, but I think it's harder for me because, like I said, for 40 plus years, I haven't been the emotional person. Like I haven't been, the person that's gonna cry. So now, like being my age, and like I was talking to my son, and we were having a conversation. And before I knew it, like I was crying. And he was like, "Oh,
Oh,
mom, why are you crying?" And I was like, "Because I love you." I don't even. Oh, it was like
He
looking
was
at
like,
him,
no, that my mama done lost it.
Right.
right?
Right. Always.
Because he can't think of a time that he's probably ever like really seen me
yeah,
cry. So like seeing me cry, he's laughing like you really are going off the deep end, lady. And
yeah,
I'm like, and then I'm like, now I'm gonna cry more because now you laughing. I'm crying. Like,
yeah,
yeah, it's bad. And the
yeah.
only way I can combat the tears is like with anger. Like I get mad so I
Oh,
don't cry. Like not like that outwardly mad, but like I'm frustrated
frustrate.
with
Yeah.
myself, right,
Yeah,
to try to hold the tears back.
I
But
get
this is like, by the time it's all over, I'm hot, I'm sweaty now. Like I done been through a whole ordeal
it done triggered
so I
you.
don't cry.
Yeah, I understand. But be encouraged. We have ways to help you.
Yeah, I got you. You try to give me an antidepressant, then you're gonna turn me loose on my husband. He
Yeah.
gonna be looking for you on Sunday at church. you, you got me taking these medications. He gonna be looking for you like, what did you tell us?
He may be thanking me if it gets you nice and even.
Right. And if it doesn't, it
Okay,
won't be a
does
thank you.
it does it? Yeah, you can.
Listen.
I'll take the blame.
Yeah, if it works, he really might be like, oh, where was you 14 years ago? Because she been crazy for a minute.
Oh man.
So yeah, so for anybody, if you're just clicking in, so the natural website is Bonafide, correct?
Yes, ma'am.
Okay, so the products that you told us about, are they are there descriptions on these
Yep,
websites?
it is.
Okay. So
Yep.
guys, the website is called Bonafide. If you know what you're looking for or a natural substitute for what you're looking for, you should be able to find some of these wonderful things that she talked about
Hmm.
on this natural, because we need to try the natural, guys. Let's slow down on some of these pills because the
I use
older,
it a lot. I use that site quite a bit for my
yeah,
patients.
the older you get, they're always trying to give you a pill for something, and nobody wants, you got a pill that does this and then it don't do this. So let's try some natural things, ladies, that might work. So that site sounds like something good. I am personally, soon as I click off live, I am going on the site and I am going to order the Serenol. See, I don't wrote it down.
Got
I'm
it.
and I'm gonna give it a try, and I'm gonna keep you guys posted. Um, because if I come on here and I be like, "Oh yeah," then
No, it works.
right? Then it's working. Or if I you come on here one Thursday night and I'm crying, just click on off and say she done fell, she done lost it completely. But we definitely want to give it a try. Tara, thank you so much for coming on.
Yeah.
Thank you
We
so much.
may we may need to have you back, but I'm gonna need a couple of weeks to regroup from this because
Recover, recover.
it
Yeah,
was a lot of information. So
it is.
you did definitely give us a lot of information. Sometimes things aren't always good to hear, like going down, but they are helpful. So we appreciate all
Yes.
the information. We appreciate your expertise. And
Yes.
it's great to have, a woman and a doctor that looks like us,
Yeah.
you know,
Absolutely.
because
I
you understand some of the complexities of being us. So
definitely.
that is always helpful. So we definitely appreciate it. So if you missed something, believe me, go back and watch it from the beginning because she gave us a lot of stuff. Some stuff that ain't happened to you yet is coming.
Oh, I
Possibly. Let me not make her look bad. Possibly. You may be on that side of people that don't have to go through all the many changes. You may not be like me because I'm hitting all the bumps in the road. I seem to be hitting. So
Checking all the boxes.
right.
yeah, all of the boxes. But I'm definitely check out the website, Bonafide, look for what you need. And if you try something, keep us posted, update us, let us know how it works for you. Because of course, everything does work differently for everybody. But we are on every Thursday, and like I said, we will have Dr. Tierra back. We'll
Thank you.
get her on her schedule and have her come back and hurt all our feelings once again.
I appreciate you.
But
Uh,
until next week, guys, you stay safe and take care of yourselves. And where is my out? Hold on, I'm always slow on this part. All right.
Thank you for watching.